3 days old newborn is diagnosed with Hirschsprung's disease. Again, this is 3-year-old with Hirschsprung's disease. The nurse is conducting physical examination. Which of the following finding will alert the nurse to suspect the disease in newborn? So one of the sign when you find out during assessment that is suspecting the disease with the newborn. So very simple question. What is the sign of Hirschsprung's disease?
Pass of meconium.
Failure to pass meconium within 24 to 48 hours. Okay, fine. So what is first option says? Palpable sausage-shaped mass. What is that indicating?
Interception.
Interception. Yeah. So first option is indicating interception. What is second option indicate? Cyanosis of finger and toes. It is called as acrocyanosis. Acrocyanosis എന്ന് പറഞ്ഞാൽ നമ്മുടെ കയ്യിലും ഫിംഗേഴ്സിലും അല്ലെങ്കിൽ കയ്യിലും കാലിലും പാദത്തിലും സോളിലും ഒക്കെ ഉണ്ടാവുന്ന സൈനോസിസ്. അപ്പൊ അത് acrocyanosis it is called as, and that is indicating hypoxia. That is sometimes indicating cold exposure, but usually for the first 1 or 2 days, acrocyanosis is okay. It is considered an okay thing, normal one. Failure to pass meconium is the sign of Hirschsprung's disease. First sign, palpable sausage-shaped mass is indicating interception. I want everyone to write down, because if you know, then you can just leave it. Otherwise, if you don't know, you please write down and learn. Fourth one, weight less than expected for height and age. Basically, for up to first 1 week, that there will be weight reduction or weight loss is expected. So it's quite normal thing. So answer is third one. Next. Discharge teaching for a child with the celiac disease would indicate instructions about avoiding which of the following? What is celiac disease? It is inability to tolerate gluten protein. Okay. അതായത് കുഞ്ഞുങ്ങൾക്ക് gluten protein tolerate ചെയ്യാൻ പറ്റാത്ത അവസ്ഥ. What is that protein called as? Gluten. Okay. Where it is found? Gluten is found in wheat,
Barley,
rye. So you could say, just remember bro. Barley, rye, oats and wheat. Okay. So avoid what? Gluten content of avoid here. So here from this, wheat is having gluten. Abam celiac disease in the inability to tolerate gluten protein. What is this gluten protein? Gluten protein is a protein found in wheat and wheat products. Fine. So when you give gluten protein, it will not be getting metabolized. So it gets accumulated in the intestine and it irritates the intestine. So it later on damages the intestine. Fine. So avoid barley, rye, oats and wheat. Next. The nurse is teaching a parent of 4-month-old who has developed a positional plagiocephaly, that is flat head syndrome. Which statement by the parent indicate need for further teaching? Basically, flathead syndrome, when you keep the baby in the same position, that particular area where the head is kept in a particular same area for a longer time, there will be chances to get an abnormal shape of that area. ഒരേ രീതിയിൽ കുഞ്ഞിന്റെ തല വെച്ച് കടന്നു കഴിയുമ്പോൾ ആ കുഞ്ഞിന്റെ ആ തലയുടെ പൊസിഷന് വ്യത്യാസം വരും. അതാണ് പൊസിഷണൽ പ്ലാജിയോസെഫാലി. Okay. Which statement by the parent indicate need for further teaching? That means a wrong statement by the parent. You have to select the wrong statement. Correct alla wrong statement edukana. 1. I should alternate head position when the infant is supine or when the infant is in supine. True or false? It's a true statement or a wrong statement?
True statement.
It is true statement. So we want a wrong statement. So I'll just remove first. Second, I should place the infant in a prone position during nap.
No.
What is wrong in that?
Wrong position.
Prone position is wrong. You should not keep the prone. Sorry, you should not keep the baby in prone position.
Wrong
Exactly.
position.
Okay. Why prone position? Why it is wrong?
Respiratory problem.
Yeah.
ശ്വസിക്കാൻ പറ്റത്തില്ല.
Yes. When you keep the baby in prone position, it can cause breathing problems or what is that? Sudden infant death syndrome. It could end up with a sudden infant death syndrome. So prone, this is a wrong thing. Okay. So we want a wrong answer. So either sometimes the second one may be an answer. We'll see. Third one, I will minimize the amount of time the infant is in a car seat. Car seat is a hard surface or a firm surface, right? So I will minimize the amount of time. That is true. We don't want a true statement. We want a wrong statement. I will place interesting toy opposite the affected side. So that is okay, right? It's true. So the answer is prone position. When you give for sleep and nap, it can cause, sometimes it can cause respiratory distress or sudden infant death syndrome. Sudden infant death syndrome. So what position is recommended? Anyway, prone is not good. So which is okay? Okay. Supine.
Supine.
You have to give supine position, but you should not give prone for child while sleeping. Clear?